And what do you think is the most hopeful thing and like is the most realistic timeline that we'll be able to have for our, extracurriculars or football and sports?
And you give me the tough questions right off the bat.
Hello, everyone, and welcome to the 5th episode of the JAISD podcast. I'm your host, Christopher Nicanor.
I'm your co-host, Jamie Leal.
And we are joined with so many officials in our sports department at PSJA as a whole, as a district. We are joined by Jeff Dar, who is our coordinator of PSJAISD Athletics. We have John Herrera, who is the athletic trainer at PSJA North. Chad Hilburn, who is representing the athletic trainers from PSJA Memorial. And Erica Martinez, who is representing our athletic trainers at PSJA Southwest, and San Juanita Sainz, who is our middle school athletic trainer who follows all of our FAR middle schools. So thank you all for joining us today. I couldn't ask you to take some more of your time, and just thank you for being here and thank you for listening to our questions. And so, UIL and the people who basically run the whole Texas football and extracurriculars have released kind of like this thing right yesterday, this like hopeful scheduling that we could follow. And I just want to hear Mr. Dar's kind of like what he thinks of that and what you think of that, and if you think that's realistic, and what do you think is the most hopeful thing and like is the most realistic timeline that we'll be able to have for our extracurriculars or football and sports?
And you give me the tough questions right off the bat. So I'm looking at it here on my other screen, and yeah, they did come out finally. The UIL has been kind of tipping it over to local policy, we're not going to come out, but they finally came out and with a calendar and modified, especially mostly for 5 and 6A schools, which we do fall under. They modified the sports calendars. The thing is, if you look at the UIL sports calendar, it's September 7th is their first start date. But as everybody here knows, Hidalgo County is especially kind of hard hit. Even Texas is hard hit. Hidalgo County is even more hard hit as opposed to the rest of Texas. And so the Hidalgo County judge and health department came out with even more strict guidelines. So their guidelines are September 27th. Before in-person instruction or extracurricular activities. So it's kind of, we kind of have to follow that as opposed to the UIL doesn't override the local government. So that's where we're at right now. There's a lot of things going back and forth as far as when we're going to start and what we're going to do. I do know that if the September 27th timeline holds, the September 28th actually is that Monday. And that's when we would begin to get everybody back and start doing some strength and conditioning. And then I think they would actually start setting up practices the following week with equipment and all that. And then I think a scrimmage maybe into the second or third week of October. First game would be like the third week of October, I believe, is when is the tentative, and that's all on paper right now. There's nothing official, but that's kind of what's being discussed and thrown around based on what's going on the ground here. And you ask what I think about all that. I think it boils down to what I just said. What's going on the ground? right in front of us. We can't really, if you go up to some small rural county and they may have 0 cases or 2 cases, that's just not the case here. And we have to kind of look at what's going on in our local, even specifically PSJA. I mean, there's a lot of people from FAR, San Juan, and Alamo that are part of all these big numbers that are showing up. People have died. There's just it's hitting closer and closer to home. So I think taking a look at hospital numbers and things like that, hopefully between now and September 27th, that's like 6 weeks from now. So hopefully, no, that is like 8 weeks from now.
Yeah, 8.
8 weeks from now. So hopefully, if the numbers are going down, we have a positive curve, which positive would be going down. I think it's definitely a doable thing, but it all depends on what those numbers look like. If the hospitals are still full, if the curve is still way up high, that you could see those timelines change again, and so that's kind of where we're at right now.
Yeah, for sure. And like the NFL right now, I know obviously we're not the NFL, but every day they released a statement like a day or two ago saying that every day they're going to have testing for practices and for the actual game. So what do you think would be like a reasonable amount of testing that we could have for our students in high school and in middle school? This goes for all of you in middle school for players and coaches.
Well, for me, I think the testing, and I'll let any of you other guys can jump in as well, but it kind of is going to, for high school, it's going to boil down to funding and cost and how many thousands and thousands of high school athletes are there just here in the Valley. We have 5,000 just here in PSJA, student athletes. So a lot of people don't register that because everybody's in their own little bubble of their team that they, respond to or play with. So, but we have 5,000 just in our district. And so times that by, Edinburgh, McAllen, Mission, you're talking tens of thousands just here in Hidalgo County. So I think there's no way to kind of compare testing at the NFL to what we would have to do in the high schools. There's no financial way we can do it.
So knowing that, like you said, hopefully things are looking better as we return on, let's say, September 24th or September 27th, right?
Yeah.
Let's say we want to return on those days. And granted, there's going to be let's hope for a steep curve down, you know what I mean? But what if we do get that steep curve down, but virus is still active and it's still going. So how will we make sure like these players don't get contract the virus or anything like that? And I think like what's a more realistic terms in testing for these students and, to make sure, they don't, spread it around the rest of the
I'm gonna let Erica jump in on that question because all of our athletic trainers were involved in. We did have like 4 or 5 days where we brought all the students in to do summer strength and conditioning, and so I'm gonna let Erica talk a little bit about what we did then and how that kind of all worked out.
Yeah, like Jeff said, I think at the beginning of June, we were allowed to bring the students in for summer workouts. It didn't last long because that's exactly when the curve started going up. But from what we saw, we had to take precautions. All the coaches and all the athletes had to do a daily survey of how they were feeling. And if they answered yes to any, for example, if they had a fever and they answered yes, they were not allowed to show up. If all that was good, then they would proceed. And they always had to, as soon as they got off the car, they always had to have a face cover on. So a mask, a gaiter, whatever it was, it had to be covered, as well as the staff. They would report to us, and we would take their temperature, and then they were allowed to go and practice. Also, UIL said that sharing water wasn't going to be an option. So as many of you know, we have big cows that have 8 drinking stations per cow. That wasn't allowed. So each athlete had to bring in at least a gallon of their own water to drink, because they weren't allowed to share or even get water from the water fountains. Other than that, we just monitored them, making sure that they always kept social distancing. Even though they were out in the football field or in volleyball, they always had to keep, if they were outside, they were keeping the 10-foot distance. And if they got any closer, their mask would have to come on. So it was just a lot of monitoring on our end as athletic trainers to make sure, because in sports, you're just always together and you've never thought about it any different. So it was about teaching the coaches, teaching the students that we're in a new norm, and the new norm is stay away from each other. So it was just like, hey, you're too close. Don't give a high five. Don't do this. And for the most part, I think all around the district, the kids and the coaches reacted really well to it. And after the second day, we didn't have any problems with that. So those were just some of the precautions that we had to take. But I know that the UIL released some yesterday too, that's also going to affect stands or fans in the stands and so forth.
Yeah.
Thank you for that. I think it's, like you said, it's so hard to let go of habits that we've done our entire lives, and it seems like everything is changing as we continue. And it just seems odd to have to socially distance at a practice. But granted, these are the precautions we have to take to ensure the safety of our students. But let's say, we obviously can't dictate what kids do at home, what our students do at home, and things like that. And so, it takes 2 weeks for coronavirus or the COVID to run its course through someone's immune system, through their body, for everything like that. And some people just prove to be asymptomatic. They don't necessarily have a fever, or on worse days they have a fever. And so they go on throughout the 2 weeks of the underlying, symptoms without showing any of these symptoms. And so how can we ensure that those students don't necessarily spread the virus to the healthy and, students who may or may not react, asymptomatically? You know what I'm saying? Yeah. And so that's when I ask, okay, we're taking these precautions to ensure that, the students don't necessarily confront each other very closely. And if they do, they have their masks on. But how can we ensure that, let's say, asymptomatic students show up and, they just, touch stuff and the football and things like that? That's where the testing comes through. And that's where my question comes through. And how often will we regulate testing?
I think it's going to come down to, we teach in athletic training circles, we teach universal precautions, wear gloves, treat everybody like they've got some kind of disease. So you're going to glove up, you're going to use all the different, you don't want to bodily fluids, things like that. And I think this is the same thing. You're going to wear a mask. You're going to keep your hands clean. The weird thing about this whole situation is that the wearing the mask, the washing the hands, the using the hand sanitizer, and the 6-foot distance, those 3 things put together, I think I read somewhere that it reduces the transmission rate by 80%. Just those simple things. And so I think wearing a face mask until this thing gets resolved is going to be part of the universal precautions that we're going to have to follow.
Yeah, and I don't think we could, assure that we're going to have someone show up that's asymptomatic. It's just going to be very important that once we know, more than likely somebody in their household will probably test and not be asymptomatic. And so we just got to make sure that we identify that kid. And then once we do, we kind of clean the stations, although we're already doing that, clean the balls. The coaches had to do all that after every practice, and then just contact tracing. which is I think you guys had heard, just who have they been involved with in close proximity, and go from there.
Yeah.
Okay, thank you. That, I mean, I just really wanted to know that because I don't know. It felt like there's been so many cases where like students my age, I'm 17, and so I'm going to be a senior in high school, and like it seems like, I mean, 99% of the people who have died from COVID-19 have been adults, so 18 and over. So I mean, we don't have a lot of 18-year-olds or 19-year-olds here playing it. I mean, in our high school level, right? Because I mean, obvious reasons, but like it feels. I just wanted to know how we would make sure that these students, you know, happen to be safe the entire time. But I mean, you guys have it down to like a science. It seems like
there isn't 100%. I mean, there's no 100%, and that's the thing. We just have to do all the best that we can do, and you know, that's what they call on the UIO website the mitigating strategies. You know, do everything we can do to lower the risk, and there's nothing that's going to be 100%. So, and that's like anything else. I mean, if you go out there and play, the risk of injury is there. The risk of permanent injury is there. I mean, it's the same thing.
You know, just to touch on what you had said, Chris, how, you know, 18-year-old kids, they're pretty much fine. They'll have some symptoms, but they're getting over it. But we have to think about, and what I think a lot of people don't think about, is that the coaches are not 18 years old, you know, and they're going home to their families as well. So it's not only about keeping the athletes safe, it's about keeping the staff, as far as coaches, athletic trainers, and everybody else safe as well.
Yeah, but what would you recommend that maybe you would feel more safe with? Because that was actually one of my next questions there. That I mean, specifically with you guys, I know you guys have family, and I mean, what are some precautions that you guys think that are necessary to follow for the next season of football or sports?
Personally, I have family at home, and I have family who are at high risk. I personally would like to see that spike come down first.
Okay.
From there on, like we said, we've already come up with plans, precautions that we need to be taking, washing our hands. Is this ever going to be gone? Well, we don't know. Living with having the flu. If you go out and play football and another kid has the flu, you can catch the flu. This might be something that we just have to live on with. However, when we have numbers where the majority of the people are getting it, the majority of people are sick, you may be asymptomatic and you are passing it around, it doesn't feel safe for me. It doesn't feel safe for my family. So for me personally, first and foremost, that spike needs to come down.
Yes, that makes sense.
I think we've always stressed to all the kids, you know, stay clean, hygiene, don't share drinks, all that stuff. But we always still had to go back and remind kids over and over. So now I think it's going to have to be something that we're really going to have to push. And it's something that's even more important now. So they're going to have to think about these things we've always taught them before. Now it's really, you know, at this point that stuff can't happen anymore.
Yeah.
Right. Yeah, you said it earlier, Chris. It's habits. And habits are really hard to break. And people get into their routine and they don't want to change it, whether it's coaches, trainers, parents, kids. Kids your age feel like you're invincible, you know. You're hearing, hey, well, kids don't really get this. They don't get sick. They don't die. The problem with that is that you can get it. You can get sick, but even if you don't, you can spread it around to people who can. And people at home, your parents, your grandparents, your aunts, your uncles. Everybody knows how the family units work here in the Rio Grande Valley, and it's so important. And so that's a tough thing for people to tell a family they need to stay apart. That's almost like blasphemy here in the Valley, you know?
Yeah.
And
Absolutely.
so you know, those are all the challenges, you know?
So we actually have some questions from the parents, like a few, just a few, like some of the most frequently asked questions. So a little FAQ for our trainers and stuff. And so one of the questions that was asked by a lot of the parents was, how will it be communicated to the parents? Like, let's say if another student happens to test positive, will the parents, I mean, parents are obviously allowed to like pull out their students and like take them out of the team. But I mean, it feels like that would be the normal case for all of our parents. It feels like our parents would want us to be as far away from people who test positive as possible. And so although these people are being taken away or being taken out, how will it be communicated to parents? And how will we communicate it to parents when an athlete has tested positive?
Right. So I can tell you that we have a chain of command just like everybody else. The school district does have policies and procedures in place, and as an athletic department, we just don't make up our own rules as to how that goes down. The UIL gives a lot of information about that as well, as to how you treat a positive case. But the way we would handle that in the athletic department is that would be reported to our health services. And we would follow the lead of our health services department within the district. And that's, I mean, that's basically how it would happen. They have a procedure that they follow as far as to how because you're dealing with a lot of privacy issues. You can't just be throwing out names and you know, saying this guy or that, you know, this person. And so so we have to really follow that guidance. And so that's pretty much how we would handle it. We do have and I'm working right now, in fact, on updating our athletic department return to campus plan. And but a lot of it is following what the school district plan says.
Mr. Herrera, you wanna speak on that at all?
No, I think also, you know, it comes down to the coaches communicating with the kids and their parents as well. You know, that someone was infected. They don't, and like Jeff said, in regards to the privacy issues, you don't have to name the kid in particular, and just to, you know, just to know what signs and symptoms to look out for, you know, with the COVID, and to make sure that everyone's safe. I mean, again, teaching proper hand washing, disinfecting, I mean, cleaning up immediately when you get home, you know, not going out to eat or picking up something from the mall, you know, just go straight home, shower, and wash your clothes.
I feel like I'm just curious because, I mean, all of my family but me, it feels like, plays football for the district. So like, I mean, you guys said that you would inform like the parents, or you guys would briefly or kind of like blanket statements that a student has tested positive, right? So would you require all of your players to, let's say, take 2 weeks off and let them see it if they come up with symptoms or come up as positive? Or would you guys continue regular practices, just exclude, let's say, this one student? Because I don't know, it feels like scary in that way. And I know you guys say you guys have your precautions, and I just want to hear what you guys have to say about that.
Yeah, that's the catch-22, especially when you're talking about team sports, like football, or even basketball or soccer, or any of those sports that are where you have close contact between a lot of students. And when we were setting up our summer strength and conditioning, the guidelines that we had were to put students, like groups of students, into small cohorts of 10, because that was back in the summer. As you know, groups of 10 was kind of the standard. And then what you could do is keep those cohorts separate and just have them work together. And so if one of those tested positive or got sick, you wouldn't have to send everybody home, just that cohort, right? Because none of them were cross-contaminating or interacting with each other. The problem once we start playing, that you can't do cohorts if you're practicing for a football game. You're practicing with the whole team, and that's going to be a challenge, because the UIL even comes out and says, school districts should plan to shut down a team for a portion of the season, because once all those people come together and start interacting together, they become one cohort. So when one person tests positive, then the whole cohort has to quarantine for 2 weeks. That's just kind of the rule. So and so you run the risk of, if you have that one kid and you're coming up on a big game or something, and on Wednesday one kid or two kids test positive, or a coach, that means everybody that was out there interacting with that person is out and has to stay home for 2 weeks. And so you're looking at, you're missing that game, you're missing the next game, and everybody's got to self-screen every day, and if they have the means or the insurance, they go get tested, whatever, that kind of stuff. So yeah, and a lot of that is spelled out in the UIL guidelines that just came out yesterday, and as to how you have to deal with a positive case. But that's the bottom line. That is the challenge in team sports.
As we know, fans are a big part of this, a big part of football, and so I'm not 100% sure, but with the UIL rules, are there fans, or are there going to be fans in the stadium, or no?
I'm looking on the thing right now, and they do have a section on spectators, audience, and fans, and yes, they are allowed.
Okay. Would you, how would you approach that? Because a lot of fans in the stadiums, I mean, that's just that could be very unsanitary, and it could cause a lot of sickness. Would you recommend limited seatings, or would you recommend no seatings at all?
Yeah, I think it'll be real easy at the main stadium, just because it's so big, and it's really easy to spread people out. You limit the number of people you come in. I'm more concerned, and I'm going to let San Juanita address this one and see what her thoughts are. But like at our middle school stadiums, and how it would work, because San Juanita takes care of, for example, LBJ Middle School, and their football games are packed every single game. The bleachers are packed, and their bleachers are tiny. So I'll let her address that question and see what her thoughts are on that.
Yeah, I mean, I think same as Jeff, if you go into the stadium, the big stadium at PSJA, you have seat numbers, you have tickets that you can buy. It's like a movie theater. You're going to pick your seat for your family that you live with, and you can't do that in middle school. We've got one security guard, maybe. Where he is, I don't know sometimes. We've got administrators roaming around, but it would take having more of the school personnel there to separate all the spectators. And just like Jeff said, I mean, you have an LBJ middle school football game, and the bleachers are packed full with parents. And is there a way to separate them other than telling them over and over again? I don't see how we could do that. Not right now, the way it is set up.
And in the release yesterday, UIL said that you are allowed 50% capacity, and every fan, and including cheerleaders, dancers, band, everybody is going to have to get screened to come into the stadium, which means temperature checks. So who's going to be doing that? Those are things that need to be discussed at the district level. And also the UIO did allow for football. It had never before to get screened online live. Before you could record it and then show it, later. But for this year, they did pass that you're allowed to watch it online. lives. So that way it deters people from coming to the game. But, you know, at some schools have a lot of community involvement and some don't. So it's going to be hard.
And I mean, you mentioned the screening, and I know we talked about the screening pretty briefly in the beginning. And I mean, can you talk us through what the screening process is for every student, player? I mean, every player, coach, trainer that walks onto the field, walks into the weight room, walks anywhere where the students may be involved. Right. So I think Jeff made a format that the school had already been using for the staff, and then we kind of just implemented it for the athletes. So it's 10 questions that ask, have you been in contact with anybody? Do you have any symptoms? You know, those are the basic questions that you've been asked, you know, if you go to the doctor's office or whatever. And they would have to do that every day online through our Rank 1 sports system, which is just a system that we use with the coaches and the athletes and us. And that was the first step. The second step was to go through screening, which is the temperature check with the athletic trainers. And go from there. I just don't know what's going to happen with the fans. I don't know if they're going to have to do a questionnaire. They don't see, so just a temperature check to get into the stadium or the gym. So, but as far as athletes, we were in charge of that. Now, that was in a small scale in the summer. You're talking about 40 football players, I think, is what 50 football players that were allowed, and 20 volleyball girls. That's all that we had showing up. Now, when school starts, you know, you're going to have all these teams, all these sports, so, you know, it's going to be a challenge having to screen everybody, but it's got to get done.
Yeah, this group is not really going to be the deciders when it comes to how we're going to handle fans and things like that. I mean, I may be a little bit involved in that, but when you go to the stadiums, if once we start, you're going to see a lot of the things you see like at the grocery stores. We're already talking about having the spots on the ground at the concession stands and at the ticket booths, and how our restrooms are set up. All that kind of stuff is going to be addressed. And, you're going to see, I think Erica mentioned about the streaming of the games. I think you're probably going to see that. Obviously we're not involved in deciding those types of things, but you're probably going to see games where you may have only parents. San Juanito was talking about it, the junior high. You may be, hey, the parents can come in and we're going to have them, blocked off spaces where they can sit, and then nobody else will be able to come in. But they may be able to put a camera up there and stream those games on YouTube or something so people can watch them. I don't really know what the talk is in the upper higher ups. So I just want to go down the line. I want everyone to answer this question because I feel like it's important. But I mean, what's the thing you miss most about being on the field, being in the gym, being, all that? I mean, obviously, like we all certainly miss our players and our students and our fans, and just, having that time with these students. But I mean, what's the one thing you really hope to come into as the new season progresses? I'm gonna let you guys.
As for me, I'm a big sports fan. So even not having sports on TV has been hard. And so that's where I miss just watching, sports, but specifically our kids. We build bonds with these kids, and we want to see them succeed and to be happy. So I'm really looking forward for them to be, to get back on the field and do what they like to do. But we just got to make sure that we're doing it safely.
I think for me, it's just the routine. I mean, we all have a daily routine, get up early in the morning, we're there till late at night. We see all these kids every day, and then, just going from that to just being at home, it's a big change.
Yeah, I think both what Chad and Erica said, and, the glimmer of hope is that, sports are starting to trickle back in. The past 3-4 days we've had Major League Baseball playing with no fans and crowd noises pumped in. It's a sign of hopefully things are getting better. But I mean, I agree. I miss the whole camaraderie. I miss coming to work. I miss, working with the student athletes and our coaches, and just the whole general routine.
Same for me. I mean, I miss hanging out with my friends who are at work. Some of the kids are crazy and tell you the craziest stories about their summer or their weekend, and they just make you laugh. And it's like we haven't had any of that since March. Zoom meetings and online meetups are what we've had, but it's not the same.
Yep, and I'll what they all said. For me, it's I like going in and working in my office. I'm kind of tired of being in my bedroom on my computer. So I'll be looking forward to that and getting back into the stadium, doing all the prep. I really enjoy doing that type of stuff, getting ready for games, all the organization and administrative stuff, and still doing that to a certain degree, but we're doing it uncertain as to what direction we're going to be heading. So
you miss our normal life.
Yep.
The hope to return back to normalcy. We all share the same thing. With everything going on and with everyone, kind of fighting about what's right and what's wrong and the precautions we should take on whether, we should even wear a mask, or whether the mask is an entire hoax, or if social distancing is a hoax. And like you guys said, you guys will require, or will you guys require students to wear masks whenever they're within the proximity of, not whenever they're in the proximity of 6 feet of each other? And so how will you guys deal with people who is it strictly you must wear a mask and you must practice social distancing currently, or are we still not sure about any of those regulations?
Well, I'll start. I mean, fortunately, I mean, there are some guidelines out there from the state and from the governor and from UIL regarding that. It has become less optional. I think it's not as optional as it was a few weeks ago. I think more and more people are saying, you know what, we really need to be doing this. And as far as, I'll just keep it in the athletics, realm here. But I mean, basically, it does give some exceptions. There are some exceptions, and I'll just read the exceptions. You got to wear a face shield, and this is from the UIL. Exceptions are if you have a medical condition or disability, and I think you judge those on case-by-case basis. If you're consuming food or drink, obviously. If you're swimming, you're not gonna, if you're a swimmer and you go back to practice, you're not going to have to wear a mask while you're swimming. When congregating in a group of persons and they maintain at least 6 feet of distance, and that's the challenging thing. You could say, well, I'm not going to wear a mask because I'm going to stay 6 feet apart. But we all know what happens when 10 or 15, especially students, get together and we put the spots down, and you say the next thing you know, hey, come here and look at this on my phone. And then you've got 4 or 5 people with head to head, right in a huddle, So, but really that's where the social distancing comes in. So there are some exceptions to the rule, but really, if you look at what the CDC is saying, if you look at what the Texas State Health Services Department is saying, wearing a mask really does prevent those respiratory droplets from traveling. Is it 100% effective? No, just like we said earlier, nothing is. but it's going to prevent that traveling of those droplets, and kind of give them another barrier that they got to get through. So I think that it's definitely worthwhile to do. I wear a mask every time I get out of my car, every time I go into a store or a restaurant or any other business. I wear a mask. I'm in there for I go in, do what I have to do, and then I go back to my car and I take my mask off. Use your hand sanitizer. Obviously, I'm at home. I'm not wearing a mask. You just got to be reasonable and smart about it, in my opinion. So if anybody else wants to chime in on that, that's what I think.
I can give you my personal experience. I'm from Oklahoma originally, and I went up there for 3 weeks, and that state had no guidelines at all. When I first got there, their cases were around 100 per day being positive. After 3 weeks, when I left, they were over 1,300 a day. So, and then they regulated the masks and all the distancing. So I'm for masks.
So,
and I think that's what's important, is that we got to, we have to follow the science. And unfortunately, science has become a little politicalized, but it's showing that masks work. So whether you believe it or not, at least if you don't care about your health, care about, those around you, and, who is it affecting? In this case, it's affecting our high school, especially our high school seniors who have 1 year. Unfortunately, last year, softball and baseball and all those spring sports didn't get their season. So that's what we're trying to avoid again. We don't want another senior class to go through the same thing. So it's just important that everybody starts thinking about other people other than themselves.
Absolutely.
I'm just going to add on to what Erica said. This has gone more than just our health. If we want to get back to that normal life, we've got to find that middle ground, what's going to help. And I believe that the mask is going to help, like Jeff said, because of the droplets and contracting it, and just wearing the mask for 5-10 minutes of whenever you're going to be in public, or protecting yourself and protecting others, doing your part. I think that's what it's all about right now.
Yeah, I completely agree with it, what everyone says. You're entitled to feel that way. For the people that don't believe in all this stuff, that think it's a hoax or conspiracy theories, but at least just do your part. Wear your mask. Stay home if you feel that way, because you don't want to be the person that passes it on to someone else.
And so I guess that's just an underlying message for our community, is just to make sure you guys are following guidelines, making sure you guys are, making sure that you guys can follow every precaution that you feel obligated to follow. Just look out for others in our community, and don't just kind of look at it from like a selfish perspective. We have students who want to play sports, students who just want to go back into in-person learning. And it seems like people don't necessarily look at education as, I guess, an important thing, because they're like, oh, I can still go out and wear a mask. And we're all members of our community, and we're all agreeing on the precautions of wearing a mask and social distancing. And please, we cannot stress this enough. And we've said this a lot on the podcast, is if you're going out, wear a mask, practice social distancing. If you don't have to leave your home, stay home. It's so hard to just fathom that people, I don't know. It's just rough. It is frustrating. Hopefully we get back, or our players get back on the field, our players get back in the gyms, things like that. So hopefully we'll see our future selves, patting us on the back for, having these regulations and having this conversation. So thank you everyone for joining us. Remember, stay safe, stay informed, and thank you for watching the Jays Up podcast.